All right, let's jump right in. Today we're talking about something that is, both incredibly exciting and, let's be honest, pretty overwhelming. Getting ready for childbirth. If you're an expectant parent, you know just how much there is to think about. So we're going to explore how a bit of planning can really change the game, turning that journey into one that feels calm, confident, and truly empowering.
First things first, if you're feeling even a little bit nervous about the big day, that is completely 100% normal. Actually, it's more than normal. It's a natural part of the whole process. But that feeling of uncertainty, that's exactly what we're going to tackle today.
It all boils down to a really simple but powerful idea. Preparation brings peace. And that's especially true when it comes to childbirth. The whole point is to take that anxiety and transform it into a sense of control, all through some thoughtful preparation. It's about feeling empowered because you're informed.
So how do we actually do that? Well, we do it with a really powerful tool called a birth plan. Now hold on. This is not about creating some rigid, strict set of rules. Think of it more like a guide, a way to take the huge unknown of labor and turn it into something you understand, something you can talk about with your doctors and nurses.
So what does birth planning really involve? Well, it's basically a structured conversation about all the key moments of your delivery. This means you get to explore your options for everything, from where you'll deliver to what your pain management choices are. It's also about getting on the same page about what happens in an emergency and making sure your personal goals line up with your medical needs. And maybe most importantly, it's a way to get you emotionally ready for labor and for everything that comes after.
Okay, this part is so important to get the most out of this. We need to be clear on what a birth plan is and what it is not. A birth plan is an informed guide. It's a tool to help you communicate. It is not a rigid script or a list of demands. It's a way to feel supported, but it absolutely is not a guarantee of a certain outcome. Making that distinction is key for setting expectations that are both realistic and healthy.
All right, now that we kind of get the philosophy behind it, let's get practical. We're going to shift from the what to the how. We're talking about mapping out the actual steps to create your plan and make this whole journey feel, manageable and a lot more straightforward.
So you might be thinking, okay, but is this really for me? Well, pretty much anyone can benefit, but planning is a real game changer for first-time parents, or for anyone who's had a difficult delivery in the past. It's also absolutely critical if you're managing a high-risk condition or if you're still on the fence about your delivery method. But honestly, it's for anyone who just wants to walk into that delivery room feeling more confident and prepared.
Timing is pretty important, right? The sweet spot to start having these conversations is in your third trimester. The general recommendation is to start the process around 28 weeks. That gives you plenty of time to think, talk, and process, with the goal of having your plan more or less finalized by about 36 weeks.
So what actually happens when you sit down for a planning consultation? Is it super formal and scary? Not at all. It's basically a 5-step conversation. You'll start by talking about your goals, your worries, and any past experiences. Then you'll do a clinical review of your health. From there, you'll explore the safest delivery options for you. You'll even get a handy checklist for the hospital. And maybe the most crucial part is that last step, planning for flexibility. The idea isn't just to plan for the perfect scenario, but to get you ready to handle any changes with total confidence. And all this prep work, it all leads to one huge emotional payoff. The entire point is to swap out confusion for confidence, to give you a real sense of control and calm as you get ready for one of the biggest moments of your life.
Yeah, just think about that for a second. This isn't about checking off boxes. The real goal here is to feel like you know your choices, to feel supported by your team, and to feel emotionally ready for your delivery, no matter what that ends up looking like for you.
I really love this quote because it just says it all so perfectly. This is what good birth planning is all about, helping you meet this incredible moment with confidence, not confusion.
Okay, so all this talk about planning usually brings up some really practical questions, right? Those what-if scenarios that pop into your head. So let's just do a quick fire round and answer a few of the most common ones.
First up, a big one for a lot of people. What if you have a high-risk pregnancy? Does all that extra medical attention mean you just can't have a plan?
The answer is not only yes, but in a high-risk situation, planning is actually even more important. It's the best way to make sure your personal hopes for your birth can align with all the clinical steps needed to keep you and your baby safe.
Okay, here's another huge one, and it really gets to the heart of managing expectations. Will the plan you make be followed to the letter? And the honest answer is that while everyone's goal is to honor what you want, flexibility is everything. Birth can be unpredictable,
And that's why a good plan doesn't just list what you want, it prepares you for what might happen if things need to change. So you're still a key part of the decision-making process, no matter what.
What about your support system? Your partner, a family member, a doula, can they be a part of this?
Oh, absolutely. Not only can they join, it is highly encouraged. Getting your support team involved is so helpful. It makes sure everybody is on the same page, they know your wishes, and they feel ready to be your advocate. It's a team sport, for sure.
And finally, a question that is on just about everyone's mind: what about pain relief? Do we talk about that? Yes, it's a huge part of the conversation. Every option, from natural techniques all the way to epidurals and everything in between, gets reviewed. The whole point is to help you make an informed decision about what feels right for you and your body.
Which brings us right back to the simple, powerful idea that really sums it all up: plan with care, deliver with confidence. It's like a two-part equation. The care you put into the planning stage pays off directly in the confidence you feel on delivery day. So, the last question is really just for you. We've talked about the path from feeling anxious to feeling empowered. And the only question left is the one right there on your screen. Are you ready to meet your birth with confidence?